So we wanted to look at what happens in that relationship between worker and patient. We decided to do that in a two-phase process. The first phase was, as you can see, an evaluation of the volume of microorganisms that are transmitted from the mouth of the provider. And we broke it into three comparative groups. No mask at all. Remember the studies from 1981 that said, you probably don't even need to wear a mask. It's not that big of a deal. A standard surgical mask, the kind that's the blue mask off the shelf, and it was the blue mask off the shelf, that's designed to mostly keep me from spitting big wads of chewing gum basically into the patient, and a true N95 respirator mask that we knew was wearable. In phase two, we wanted to look at if there is bacteria coming out of my mouth in this study, and the study people's mouths, where does it go? Does it just hang out there? Does it float over into your hair? Where's it going, and does it matter? Because if it's not going where the patient is, then maybe it doesn't matter at all. So consented volunteers, head held stable for 2 hours, normal conversation in the same agar plate collection, and then we looked at what was collected. Each volunteer had a 2-hour session, no mask, a 2-hour session on a separate day, same time of day, so that we could make everything as close as possible. Surgical mask and an N95 mask. This is not me, just want to make that clear. This is actually somebody who works for me in the office who was healthy, 23 years old, no medical issues. But take a look at the number of things growing on those plates. This is no mask. This is a nice big ball of fungus here in the center. Mixture of gram-positive and gram-negative bacteria, and there's a lot of them there. The center plate is with a regular surgical mask. You can see it's better. There's a lot less bacteria than there were when they wore no mask at all. There's still a nice fungus ball here. Now if you switch to an N95, very few colonies. A huge drop in the number of colonies that we see that actually made it out of the mouth, same 2-hour time period, same people. If you look at it statistically, here's what you see. Reduction from baseline, and baseline being the no mask at all. Standard surgical mask cut the number of colonies in half. N95 mask cut it by over 80%. So when you put that through a dependent t-test for statistical significance, you can see it was very, very significant with a p-value of less than 0.001. So the chances of this being accidental was less than 1 in 1,000, essentially. So a very statistically significant drop in wearing the right kind of mask, keeping the bacteria in, away from where it was going. So now we're confident that bad bacteria are coming out of the mouth, but where are they going? So we set up a simulated operating room environment with standard airflow, no laminar flow. We had both a surgeon and a first assistant during each of the trials. Again, they had a normal conversation. We did simulated procedures that lasted 15 minutes, 30 minutes, and 60 minutes to see if there was also a difference. So here's our patient. Even though we're in an operating room, everything is set up normal. Our patient is 8 agar plates simulating an open abdomen, and that's where we positioned the surgeon and the first assistant. They had to keep their hands on the table away from the plates during the entire procedure so that we knew they weren't doing this and bringing bacteria in from the wrong environment. And then we had controls scattered around the room as well. And here's what we found. You can see the raw data there in front of you, but if you just go to the far side under the average, you can see that at 15 minutes, there's a big drop. At 30 minutes, there's a bigger drop. And at 60 minutes, there's a huge drop of how many bacteria land in what would have been the open abdomen. No mask at all, 464 colonies on average. Surgical mask, cut it in half. But that wearing an N95 mask, they had less than 1/4 of the number of potentially harmful, nasty bacteria coming out of my mouth and landing into their abdomen. So after the study, What did we know? Well, we knew a little bit more. We still know that surgical smoke contains chemicals and particles that are harmful to the providers. We didn't challenge that. We didn't study that. But the data is out there, and for anybody that works in an operating room that chooses to believe that surgical smoke smells good, like I did, and it's not harmful, simply means you haven't taken the time to read the data, just like most of us haven't for years and years. We know that significant bioburden is transmitted from the mouth and the nose of the care provider. We know that if you wear the right mask and switch to a respirator, particularly in those cases where you're really concerned about infection, that the transmission of the bacteria drops substantially. In cases where there's going to be a surgical smoke, in cases where lasers are going to be used, or a lot of cautery, the thought process of wearing a mask to protect yourself just simply makes sense.